medical officers at hospitals around the region that talked about the decline in available ICU beds and other hospital resources. That is based on demand that is coming not just from Kansas City, not just from our suburbs, but also from rural Missouri and Kansas. And just the last week, I've had a number of conversations with folks who talked about the fact that we're seeing patients at places like Research Medical Center in Kansas City, Truman Medical Center, St. Luke's, et cetera, that are dealing with an influx of patients from throughout the region. And we thought it was important and time to act. As you also would have seen and reported last week, health directors, not just Dr. Rex Archer of Kansas City, but the health directors of Jackson County, Missouri, Clay County, Platte County, Wyandotte County, Johnson County, Kansas, listed a set of recommendations for us, and it's those recommendations that are a basis for the orders that we're announcing today. First, change in restaurant and bar rules. You'll see that restaurants and bars, we have a recommendation of closure at 10 p.m. In Kansas City, Missouri, bars are allowed in some situations to be open until 3 a.m. So why cutting 5 hours of possible business for them? First, we recognize the challenge, but we also recognize the fact that particularly in the later hours, through our health department enforcement, we've seen laxer enforcement from private actors of rules relating to social distancing, laxer enforcement of mask requirements, and those challenges have led us to believe that this is the best way before people are inebriated in later hours, before they're crowding, to avoid certain bar and restaurant issues. Another addition is the fact that at all bars and restaurants in Kansas City, you must be seated while in the facility. So no standing around. My office often receives videos or pictures from certain entertainment districts throughout Kansas City where folks are standing around on dance floors close to each other, etc. The seating requirement will be something that is enforced for all restaurants and bars unless you're actively going to be seated or going to a restroom or something of that sort, then you must be seated. If you are standing at any time, you must have a mask on. Violations of those rules will be enforced by our health department as well as the Department of Regulated Industries. This order also gives the police department, the fire department's ability to enforce relevant parts of those orders. There has been some question as to the requirement to wear masks for all those in Kansas City. This order eliminates the exception of wearing masks for everyone, largely. That means that those who are members of the Kansas City Police Department, the Kansas City Fire Department, and others are required to wear masks in commission of their duties as well. This will be an all-around requirement for everyone, very few exceptions. The exceptions will now be only children under the age of 5 are exempted, or those who can't wear masks for certain medical reasons. No longer is there an exemption for public safety, essential business, any other types of items. A few other things to note. Restaurant and bar capacity will be limited to 50% in Kansas City. In addition, gyms, fitness centers, and other recreational centers, including, and importantly, school-based gyms and recreation centers, will have a mask requirement and will be subject to social distancing and capacity requirements as well. There is much question about indoor and winter sports activities. As this order is currently written in relation to both schools and youth activities, those would require a mask to be worn if they're taking part. If there is an effort to have some crowd at a venue, that would have to be approved by the Director of Public Health because there is an additional rule that limits all groups to the number 10. So group limits being at a size of 10. All groups. And so if you look to have an indoor event, congregation, etc., you may not if it's over 10 unless there is some specific permission from the Director of Public Health. That will include spectators at games, concerts, events, weddings, etc. I've had a few people ask me questions. Mayor Lucas, my daughter or son is getting married at a Kansas City entertainment venue in 2 weeks. Can that proceed? The answer rather clearly is no, unless there is some explicit approval from the Department of Public Health. A few other things to note, and then I'll introduce our other speakers for today. One of those is that we take these actions not to be punitive, and we certainly take them cognizant of business challenges in Kansas City. I had a conversation with our director of the Economic Development Corporation of Kansas City, who noted that Kansas City, Missouri has given out more than $3.2 million in small business funding support in recent months. We call on our allies, both at the federal legislative level and the state legislative level, to help us help our businesses. But importantly, it is vital for us to continue to try to stop the spread of COVID-19. A few other points that I wanted to mention while we were still here. We do believe that reducing the size of all groups to 10 will be something that makes a strong difference, but there is more to that. You really should not be associated with many groups outside of your home yourself. That's why we're seeing the limit on public activities. That's why we're seeing some of the issues that we are addressing now. What's more, we will add a mask requirement in the outdoors if you cannot maintain social distancing or if there's no health or other public safety issue relating to that distance issue as well. I continue to call on the counties that surround us in the Kansas City area to issue things like mask requirements. I continue to ask so many others to look at the good public health guidance that we need. Kansas City is working its hardest to make sure that people stay safe. Each day, we're working with our school districts, we're working with our hospital leadership, we're working with so many to make sure that folks can be safe long term. But importantly, it relies on everyone. It relies on folks to follow the rules. It relies on us to enforce the rules. We will continue to enforce the rules, whether it be a U-Haul facility, a club, a bar, or anything of that sort. If you have an issue with compliance with COVID-19 rules, we encourage you, if you've seen non-compliance, to email COVID violations at kcmo.org or to call 311. Dr. Archer's department has had quite a bit of work to do over recent months, but we have appreciated many who have contacted us. That's why we're giving a direct line for those sorts of violations at issue. I also have noted this already, but we recommend folks cancel at least the normal version of their Thanksgiving plans. We also recommend that all other large event plans be canceled or postponed if you can do so. It's very simple. Every wedding, every Thanksgiving, every large event is a potential for large community spread. We have seen it time and again. People that did not intend to get relatives sick, people who did not intend to get friends sick, people who did not intend to get coworkers sick. That has been a significant problem for us, and so we ask you, we implore you, and through the full extent of our legal orders as possible, we direct you to make sure that you are not engaging in any activities above 10 persons, and to make sure that you're not engaging in those activities that will be risky for Kansas City or our entire region. I'll be followed today by Dr. Rex Archer, our Director of Public Health, then Dr. Erica Carney, our Director of Emergency Medical Services, and then Adele Duchard. She'll give you her full name and spelling, from St. Luke's North Hospital to talk about the impact. I'll come back and answer questions, followed by Dr. Archer answering questions, and then we'll see if we still have an appetite to proceed from there. A few other things that I'll note just before I get off. This has been a regional conversation and a regional effort. You're seeing orders perhaps rolled out in different times. Some of that relates to political realities of different jurisdictions. I've had the opportunity to talk to leaders in a number of different areas, most recently Jackson County, Wyandotte County, and Johnson County just last night. I know Dr. Archer has talked to health directors throughout our region and all health directors throughout our region. Everybody recognizes there's a significant challenges and there's a significant concern, even if our rules may look a little different. We encourage all of you to wear masks, maintain social distancing, and refrain from social events. We can't say that enough. And if we do this over the next several months, that may buy us the time necessary to get to the point where we have a vaccine, to get to the point where we can be safer. So with that, I'll introduce Dr.